The method's foundation is the mucus sign, which reveals a woman's reproductive period regardless of whether or not she wants to become pregnant. Every day, many women have some form of mucus, but only a small number of days during each cycle experience the unique ovulation mucus. To recognize it, you simply need a little experience. This mucus indication is apparent and obvious as soon as a woman starts to notice it. After a few cycles, it is not an exaggeration to argue that the shifting feelings she experiences and the presence of the mucus act as a reminder bell, alerting a busy woman to her potential fertility. Most women can identify their fertility after being informed of what it signifies without ever looking at the mucus. They are conscious of the slick or sticky feeling as they move around. Every fertile lady can have a slick or sticky feeling when wiping after urinating on fertile days. The mucus sign has two components. 1. Observing the sensation she experiences while dabbing the vulva, the area outside the vagina. 2. Watching for any mucus to appear. She believes that this is the most crucial finding. The mucus test, formerly known as the stretch test, involves a woman merely drying herself off after every urine in order to determine the most crucial aspect of the mucus indication, which is checking for what she feels. After urinating, she quickly wipes the vulva, the exterior of the vagina, and assesses whether she detects any mucus, whether it is slippery or non-slippery, sticky, or nothing at all. Even the busiest woman will become aware of what she is feeling once its significance is brought to her attention. The mucus test starts with observing this sensation. Observing how the mucus appears is the second step of the mucus test. Although it is not as significant as what is felt, this is particularly significant for people who want to choose the sex of their future kid in advance. She stretches the mucus with the other hand to determine if it is clear, slightly cloudy, or very cloudy. She also checks to see if it stretches and holds its shape or breaks rapidly. Although it just takes a moment, a lady has never done this before. As the mucus nears its peak, its appearance changes from day to day. It is important for women to remember that nature takes care of the vagina, so there's no need for cleaning it for risk of removing the normal flora. Only the outside of the vagina should be washed for normal hygiene, the vulva. The mucus is not washed away by urine. However, it is traditional for women to urinate outside of the vagina in some places. They ought to feel the area in this instance before washing. It's crucial to understand that the best technique to test for stickiness or slickness in the vagina is against the woman's own body, by touching against the outside of the vagina. The wrong way to accomplish so is by sticking a finger inside the vagina. Doing so invalidates the mucus indication and is unclean. For a variety of reasons, the vagina is frequently slick within. It is not by rubbing the mucus between the fingers. It is not by rubbing the finger on the toilet paper afterwards. There is no issue if there is no toilet paper. Touch lightly and then wash your hands as usual. Effect of contraceptive pill. Normal fertile indicators do not appear since the pill typically prevents ovulation from occurring, unless in the case of the very low dosage one. The monthly bleeding that women experience is not actual menses. It is brought on by the pill. When to do the mucus test. The mucus test is performed following each urine during the day and cycle. Only at night, just before going to bed, is charting done. There are numerous issues that arise from a failure to comprehend this. Whatever is the most fertile sign you observed during the day, you chart it at night. Notices throughout the day are 4 words that you should keep in mind. Which sign is the most fertile, then, will follow. Women on night duty schedule before retiring for the night. Sensations, things you feel at the vulva. Dry, nothing in particular is felt. Wet, it feels like water and is not slippery. Sticky, it feels sticky like thick pap or thick corn flour and does not feel slippery. Slippery, it feels like oil. Black, blue, and red colors. The colors black and blue have the same meaning in charts. Red represents fruitful days, whereas blue or black represents infertile ones. Because blood is red, menstruation is also identified by its color. You might find it interesting to look at Appendix 2 for the worldwide charting symbols for the Billings approach. Ovulation mucus comes in two varieties, early pap and egg white. The first sign of ovulation mucus is early pap. It is the first deviation she notices from her basic infertility pattern, BIP, which is dryness, and it is also the first sign of impending ovulation.
If you love our work, we would be thrilled if you choose to like and subscribe.